Identify the chemotherapeutic agent. A. Furosemide. B. Levofloxacin. C. Lamotrigine. D. Methotrexate. E. Gabapentin. The answer is D. Methotrexate. Methotrexate is a chemotherapeutic agent. Levofloxacin is an antibiotic, lamotrigine is a mood stabilizer, gabapentin is an anti-epileptic agent, and furosemide is a diuretic. The oncology nurse cares for a patient receiving internal radiation treatment for cancer. Which of the following scenarios most concerns the nurse? A. The nursing assistant provides care in the patient's room for 2 hours during the 8-hour shift. B. The patient complains about remaining on bed rest and asks to stand up. C. The nursing student stands away from the patient while talking to him. D. The charge nurse asks providers if they are pregnant before assigning them to this patient's care. E. The physician performs a physical assessment for 10 minutes. The answer is A. The nursing assistant provides care in the patient's room for 2 hours during the 8-hour shift. When caring for a patient receiving internal radiation, the length of exposure to the radiation is a high priority for the nurse. It is important to rotate staff who care for the patient, limiting close contact to 30 minutes per 8-hour shift. Additionally, it is important to organize tasks so limited time is spent in the client's room. Visitors must also be limited. Pregnant women should not be assigned to work with this client. The patient must be on bed rest while sealed sources of radiation are placed. It is also important not to stand close to the radioactive source. Which of the following is not a proven risk factor for the development of oral cancer? A. Excessive alcohol consumption. B. Human papillomavirus, HPV. C. Regular use of alcohol-containing mouthwash. D. Tobacco product use. E. A diet with inadequate amounts of fruits and vegetables. The answer is C. Regular use of alcohol-containing mouthwash. All of the above are proven risk factors with the exception of mouthwash use. Poor dental care, prolonged present irritation, such as excessive flossing, tobacco and alcohol abuse, infection with certain strains of HPV, and an unbalanced diet can increase the risk of oral cancer. Which leukemia is linked to the Philadelphia chromosome? A. Chronic myelogenous leukemia, CML. B. Chronic lymphocytic leukemia, CLL. C. Acute myelogenous leukemia, AML. D. Acute lymphocytic leukemia, ALL. The answer is A. Chronic myelogenous leukemia, CML. The Philadelphia chromosome, which is an abnormality in chromosome 22, is most often found in bone marrow cells of patients with chronic myelogenous leukemia. It may also occasionally be found in acute lymphocytic leukemia, though this is rare. Reed-Sternberg cells are pathognomonic in what type of cancer? A. Non-Hodgkin's lymphoma. B. Acute myeloblastic leukemia. C. Acute lymphocytic leukemia. D. Hodgkin's lymphoma. The answer is D. Hodgkin's lymphoma. Reed-Sternberg cells are the pathognomonic cells of Hodgkin's lymphoma. These are mutated multinucleated B cells with a large amount of cytoplasm. These cells can be present in other pathologies. The diagnosis of Hodgkin's lymphoma can only be made if the Reed-Sternberg cells are in the presence of non-neoplastic inflammatory cells such as lymphocytes, plasma cells, and eosinophils. What protein is found in the urine of patients with multiple myeloma? A. Binns-Jones protein. B. Tau64. C. Albumin. D. Alpha-synuclein. The answer is A. Binns-Jones protein. Binns-Jones proteins are present in the urine of over 60% of multiple myeloma patients. Albumin may be present in the urine of these patients, but it is not pathognomonic for multiple myeloma. Alpha-synuclein is associated with neurodegenerative conditions, and Tau64 is a protein present in the neurons of patients with Alzheimer's disease. What is the most common symptom of Hodgkin's lymphoma? A. Bone pain. B. Fatigue and weight loss. C. Easy bruising. D. Prolonged enlargement of one or more lymph nodes. The answer is D. Prolonged enlargement of one or more lymph nodes. The most common symptom of Hodgkin's lymphoma is the painless enlargement of one or more lymph nodes. Unexplained weight loss and fatigue may also be present, but are more likely to present later than lymph node enlargement. Bone pain and easy bruising are not typically seen. What tumor antigen will be elevated in prostate cancer? A. Cancer antigen 125, CA 125. B. Tyrosinase. C. Prostate-specific antigen, PSA. D. Alpha-fetoprotein, AFP. The answer is C. Prostate-specific antigen, PSA. In prostate cancer, patients will have elevated levels of prostate-specific antigen, PSA. Cancer antigen 125, CA 125, is elevated in ovarian cancer. Alpha-fetoprotein, AFP, is elevated in hepatocellular carcinoma, and tyrosinase is an enzyme that is often highly elevated in malignant melanoma. The oncology nurse cares for a patient who has been newly diagnosed with leukemia. Which of the following sets of symptoms would the nurse not expect during the initial physical assessment? A. Mouth ulcers, low leukocyte count, weakness. B. Throat ulcers, pneumonia, anemia. C. Lethargy, bleeding gums, petechiae. D. Headache, ecchymosis, retinal hemorrhages. E. Weight gain, high red blood cell count, flushing. The answer is E. Weight gain, high red blood cell count, flushing. Leukemia is a cancer of white blood cells, limiting the ability of the body to fight infection. Patients with leukemia exhibit altered leukocyte counts, less than 500,000 per cubic millimeters, as well as ulcerations of the mouth and throat, pneumonia, septicemia, anemia, fatigue, lethargy, weakness, pallor, weight loss, headache, disorientation, and forms of bleeding, including bleeding gums, ecchymosis, petechiae, and retinal hemorrhaging. Patients with leukemia do not usually exhibit weight gain, usually loss, high red blood cell counts, usually anemic, and flushing, usually pallor. The oncology nurse cares for a patient newly diagnosed with breast cancer. What are common risk factors for this type of cancer? A. Immunosuppression, advancing age, genetic predisposition. B. Smoking, advanced age, genetic disposition. C. Stress, advancing age, chronic irritation. D. Pharmaceutical use, alcohol, radiation. E. Radiation, chronic irritation, smoking. The answer is A. Immunosuppression, advancing age, genetic predisposition. All of these may be factors in the diagnosis of cancer. The operative word in the question is risk. Common risk factors for breast cancer include previous immunosuppression, advancing age, and genetic predisposition. Common causative factors include smoking, alcohol abuse, radiation, chronic irritation, consumption of food additives, exposure to industrial chemicals such as asbestos, exposure to dangerous pharmaceuticals such as stilbestrol, previous viral infections such as Epstein-Barr, and stress, when combined with other causative factors. You are the nurse taking care of a patient newly diagnosed with ovarian cancer. Which of the following biomarkers is typically followed to assess the progress of disease, or response to treatment, in ovarian cancer patients? A. BCR, ABL. B. c-Kit. C. Prostate-specific antigen, PSA. D. Cancer antigen 125, CA125. E. Cancer antigen 199, CA199. The answer is D. Cancer antigen 125, CA125. CA125, also known as mucin 16, is a glycoprotein that is found to have elevated serum levels in patients with a variety of cancers, including ovarian cancer, and benign conditions, as compared to patients without such conditions. As a result, monitoring California 125 levels can be used as a method of tracking disease progression or response to treatment based upon what the initial CA125 level is at the time of diagnosis. On the other hand, the other choices are incorrect. Cancer antigen 199, CA199, is incorrect as this is a biomarker in pancreatic cancer, not ovarian cancer. Prostate-specific antigen, PSA, is incorrect as this is a biomarker in prostate cancer, and other prostate conditions, not ovarian cancer. c-Kit is incorrect as this is a biomarker in gastrointestinal stromal tumors, not ovarian cancer. BCR, ABL is incorrect as this is the translocation found in the Philadelphia chromosome implicated in chronic myelogenous leukemia, not ovarian cancer. You are the nurse taking care of a patient newly diagnosed with pancreatic cancer. Which of the following biomarkers is typically followed to assess the progress of disease, or response to treatment, in pancreatic cancer patients? A. Cancer antigen 125, CA125. B. CD20 antigen. C. Cancer antigen 199, CA199. D. BRAF. E. CD30. The answer is C. Cancer antigen 199, California 199. California 199 is often elevated in patients who have pancreatic cancer, or certain types of colon cancers, and can be used to assess response to treatment and/or disease progression. On the other hand, the other choices are incorrect. Cancer antigen 125, California 125, is incorrect as this is a tumor marker used to track ovarian cancer, not pancreatic cancer. CD20 antigen is a tumor marker for B-cell lymphomas and leukemias, not pancreatic cancer. CD30 antigen is a tumor marker for anaplastic large cell lymphoma, not pancreatic cancer. BRAF is a tumor marker for melanoma, not pancreatic cancer. Which of the following image modalities would be best suited to diagnose a suspected lung cancer? A. EKG. B. Chest X-ray. C. EEG. D. CT scan. The answer is D. CT scan. CT scan is the preferred imaging modality to view a tumor in the lung tissue. A chest X-ray might initially find a nodule or abnormal marking in the lungs, but it must be followed up with a CT scan to be diagnostic. EKG looks at the heart and EEG looks at the brain. You are the nurse taking care of a patient in an oncology clinic who was treated with chemotherapy and radiation therapy for anal cancer. The patient finished treatment 2 weeks ago. Which of the following treatment side effects would you expect to see? A. Fever. B. Pupil dilation. C. Eye redness. D. Headache. E. Rectal bleeding. The answer is E. Rectal bleeding. The patient is being treated with chemotherapy and radiation therapy for anal cancer, and is multiple weeks removed from treatment. Rectal bleeding is a very common side effect in patients who recently received radiation therapy to the anus, as numerous blood vessels are treated by the radiation therapy, and the body's immunologic response to radiation therapy also promotes vascular permeability. Rectal bleeding, unless profuse and uncontrolled, is often a self-limiting phenomenon in the setting of radiation, and while troublesome for the patient, does not pose much of an acute threat to the patient's stability. Or radiation therapy for anal cancer, fever is something that should be taken seriously in any cancer patient, especially one receiving chemotherapy. However, it should not necessarily be expected. It should always be assessed for. Headache is a common side effect in patients actively receiving chemotherapy, often either directly due to the chemotherapy drug itself, or to dehydration as a side effect of treatment, lack of appetite. This patient is multiple weeks removed from chemotherapy though, so headache would not be expected as a treatment side effect at this time. Pupil dilation and eye redness are not typical side effects of chemotherapy or radiation therapy for anal cancer. You are the nurse at an oncology practice taking care of an otherwise healthy 22-year-old male being treated with chemotherapy and radiation for Hodgkin's lymphoma. His chemotherapy regimen consists of doxorubicin, bleomycin, vinblastine, and acarbazine. He is not receiving any other medications. He reports feeling well aside from fatigue, and numbness and tingling of his hands and feet. Which of the following is the most likely cause of the hand and foot numbness and tingling? A. Diabetic neuropathy. B. Posterior spinal cord degeneration. C. Selective serotonin reuptake inhibitor discontinuation syndrome. D. Bleomycin-induced neuropathy. E. Vinblastine-induced neuropathy. The answer is E. Vinblastine-induced neuropathy. This is the most likely explanation for this patient's peripheral neuropathy, as the patient is described as being healthy aside from Hodgkin's lymphoma, and on no medications aside from his chemotherapy regimen. As a result, diabetic neuropathy and selective serotonin reuptake inhibitor discontinuation syndrome can each be ruled out as etiologies. Similarly, given that he is otherwise healthy and not complaining of any additional neurological symptoms, and given that he is young and actively receiving chemotherapy, it is unlikely that he is experiencing posterior spinal cord degeneration. Thus, in a young patient with lymphoma who is receiving chemotherapy and experiencing peripheral neuropathy, the most likely etiology is one of the chemotherapy medications that he is receiving. In this patient's case, he is receiving doxorubicin, bleomycin, vinblastine, and acarbazine. Of these medications, Vinblastine is the most strongly associated with peripheral neuropathy, as this is a fairly common side effect of vinblastine and other agents in the same class, vinca alkaloids. As such, vinblastine-induced neuropathy is the most likely etiology. You are a nurse at an oncology clinic taking care of a 65-year-old male with stage 1 non-small cell lung cancer, NSCLC, who is 1 year removed from a wedge resection and chemotherapy. Which of the following tests would be best to assess treatment response in this patient? A. CT, without PET. B. X-ray. C. Pulmonary function tests. D. PET, CT. E. MRI. The answer is D. PET, CT. PET, CT shows not only spatial information from the serial slices taken on CT imaging, which would include the size and location of any potential tumor, scarring, or nodal involvement, but also the FDG avidity or uptake of the contents of the image, which would help correlate the spatial findings with possible disease activity. Nodules observed on a CT scan can be nondescript, ranging from malignant, to indeterminate, to benign, which may still be infectious or inflammatory. The addition of PET to a CT allows the observer to see which nodules, nodes, or lesions are more likely to be indicative of disease burden, as tumors and infections will have greater FDG uptake since they are more metabolically active than surrounding tissues. MRI is not typically used to assess treatment in lung cancer, as CT coupled with PET is more commonly used. X-ray does not provide enough resolution to adequately assess response to cancer treatment. Pulmonary function tests, while a useful measure of lung functionality, do not give a specific picture of the lung cancer burden and as such are not the best treatment response assessment tool. You are the nurse in an oncology clinic taking care of a patient with a glioblastoma who has been receiving chemotherapy and radiation therapy. You want to assess response to treatment. Which of the following images would best assess treatment response? A. CT head without contrast. B. PET, CT. C. MRI head. D. X-ray head. E. CT head with contrast. The answer is C. MRI head. In evaluating brain parenchyma, which is relatively soft tissue, MRI provides the greatest degree of spatial resolution, which would best allow assessment of any residual, recurrent, or new tumor burden within the brain. CT imaging is commonly used to assess the brain when evaluating for bleeds or fractures, among other conditions, as it is far more expedient than MRI. However, it does not visualize the soft tissue of the brain parenchyma as well as MRI, and treatment response MRI scans are often not emergent, and therefore MRI would be preferred. PET, CT, while often highly useful in oncologic assessments, is of limited value in evaluating the brain for cancer response, because the entire brain is highly metabolically active in nearly all patients, and therefore the entire brain typically has a great deal of FDG uptake uniformly, limiting the value of the scan. A client had just undergone a total right knee replacement and has just returned from the operating room. Later that evening, the client suddenly begins to complain of shortness or breath and chest pain on inspiration. The nurse caring for this client further notes the coughing up of blood and that he is sweating profusely. Which of the following nursing interventions should the nurse perform first? A. Assess the client's mental status. B. Place in Fowler's position. C. Auscultate for breath sounds. D. Give oxygen. E. Draw blood for arterial blood gases, ABGs. The answer is B. Place in Fowler's position. The priority for this client is to ensure a patent airway by placing him the Fowler's or semi-upright seated position. Giving oxygen is warranted but will be given after the client is positioned correctly. ABGs would be helpful in this situation but is not the priority. Auscultation of breath sounds and assessment of mental status are not indicated. What is the final stage of a pertussis infection? A. The recovery phase. B. The convalescent stage. C. The post-infectious stage. D. The paroxysmal stage. The answer is B. The convalescent stage. The final stage of a pertussis infection is known as the convalescent phase. This occurs for 2 to 6 weeks, after the paroxysmal stage of the disease. During this time coughing decreases, and paroxysms are less severe. The infected individual may experience increased susceptibility to upper and lower respiratory conditions for as much as 6 months after resolution of the infection. Which of the following organisms causes whooping cough? A. Haemophilus influenzae. B. Bordetella pertussis. C. Human respiratory syncytial virus, RSV. D. Klebsiella pneumoniae. The answer is B. Bordetella pertussis. Whooping cough, a condition that results in severe paroxysmal coughing fits followed by a long wheezing inspiratory gasp, the whoop, is caused by the bacteria Bordetella pertussis. Haemophilus influenzae and Klebsiella pneumoniae both commonly cause pneumonia, and RSV is a virus that is frequently implicated in lower respiratory infections of infants and children. In pertussis, what stage follows the incubation, also known as the catarrhal stage? A. The whooping stage. B. The paroxysmal stage. C. The acute stage. D. The convalescent stage. The answer is B. The paroxysmal stage. After the catarrhal stage, an individual with pertussis will progress into the paroxysmal stage. It's during this stage that they will experience uncontrollable fits of 5-15 forceful coughs, followed by a whoop or gasp as they struggle to inhale. The force of these coughs can be such that they can result in vomiting, epistaxis, subconjunctival hemorrhage, or even broken ribs. How long is the incubation period for pertussis? A. 4 to 6 weeks. B. 1 to 3 weeks. C. 2 to 3 months. D. 2 to 7 days. The answer is B. 1 to 3 weeks. The incubation period for pertussis, also known as the catarrhal stage, can last as little as 4 days or as long as 42 days, but a typical period is 1 to 3 weeks. During this stage the disease looks like a regular upper respiratory infection, with sneezing, mild cough, and runny nose. The infected individual is highly infectious at this time, with bacteria spread by airborne droplets after sneezing or cough. You are the nurse taking care of a 40-year-old African American female who complains of fatigue and shortness of breath. Her physical exam is remarkable for erythema nodosum on the bilateral lower extremities. A chest X-ray is performed that demonstrates bilateral hilar infiltrates. She lives and works in a suburb, has not traveled outside of the United States recently, and does not work in a healthcare setting. Which of the following is the most likely diagnosis? A. Meningitis. B. Sarcoidosis. C. Lung cancer. D. Pharyngitis. E. Tuberculosis. The answer is B. Sarcoidosis. This inflammatory condition is frequently found in African American women in their 40s who present with fatigue and shortness of breath among other symptoms, who also have erythema nodosum on the lower extremities, and have bilateral hilar infiltrates on chest X-ray. This constellation of findings is highly suggestive of sarcoidosis. Sarcoidosis results in the formation of numerous non-necrotizing granulomas, most commonly found in the lungs, that can play a role in the symptoms experienced by these patients. Other findings suggestive of sarcoidosis include elevated serum calcium levels with normal serum PTH levels. Tuberculosis can present in a similar manner to sarcoidosis, however, given the patient's suburban living environment, lack of a travel history, and lack of healthcare exposure, the likelihood of being exposed to tuberculosis is very low, making sarcoidosis a more likely etiology. While lung cancer can present a shortness of breath with hilar infiltration in chest X-ray, in a relatively young otherwise healthy patient who also has erythema nodosum and in whom the hilar infiltrates are bilateral, sarcoidosis would be a more likely etiology. The patient does not have any findings consistent with meningitis. Legratian meningitis is petechial, not erythema nodosum, or pharyngitis. What is the hygiene hypothesis in asthma? A. Keeping children's hands clean will reduce asthma rates. B. Dirty water is responsible for many cases of asthma in the developing world. C. Frequent bathing can reduce the severity of asthma attacks. D. Exposing children to pathogens at a young age will decrease their risk for asthma. The answer is D. Exposing children to pathogens at a young age will decrease their risk for asthma. Incidence of asthma is lower in populations exposed to an abundance of microbes from a young age. The hygiene hypothesis suggests that early immune stimulation by multiple forms of infectious agents may push a Th1 phenotype, reducing the Th2, allergic, response. All of the following are common triggers for asthma except dash. A. Exercise. B. Squatting. C. Cold air. D. Emotional stress or excitement. The answer is B. Squatting. The most commonly reported triggers for asthma attacks are cold air, emotional stress or excitement, infection, irritants such as pollen or dust mites, and exercise. Other triggers may include lying down, exposure to cigarette smoke, or acid reflux.